Good afternoon. Welcome to the May 5th Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia. Here. Edgeworth. Here. Gonzalez. Goulding. Gray. Hafen. Here. Hibbets. Here. Hunt. Here. Jackson. Here. Koenig. Here. Nadeem. Here. Nguyen. Here. Orntlicker. Here. Chair Brown-May.
Here, thank you. If you would please mark Assemblymember Gray absent excused and Assembly members Gonzalez and Goulding present when they arrive. They're in committees presenting other bills at this time. Thank you and welcome to the Committee on Health and Human Services on this Cinco de Mayo, Monday, May 5th. As a reminder, please remember to silence your electronic devices. If you wish to testify, sign in at the table by the door, provide a business card. Remember to state your name if you testify. Members of the public may provide public testimony or comment. Today you would do that by dialing 888-475-4499 and then entering today's meeting ID, which is 898-537-34811, and then entering the pound sign when prompted. Public comment will be taken today at the end of our meeting. Each person interested in public comment will be allowed 2 minutes. As a reminder, we expect courtesy and respect in all of our interactions, and committee members will be using their laptops or other electronic devices. We do have 3 bills on our agenda today. We are going to attempt to take them in order. The first bill is Senate Bill 284, and we will officially stand in recess until the Majority Leader joins us. She's on her way up currently, and then we'll call back to order. So we are in recess. Thank you, members, for your patience. At this time, we will come back to order, and we will officially open the bill hearing for Senate Bill 284, and we will welcome the Majority Leader to the table. Please take your time. You're welcome to begin whenever you're ready.
Thank you, Madam Chair and members of the Health and Human Services Committee. My name is Nicole Canizaro, and I proudly represent Senate District 6 in the northwest portion of the Las Vegas Valley, and also serve as your Senate Majority Leader here at the Legislature. I am very proud today to be presenting to you Senate Bill 284 alongside Mr. Jonathan Norman, who I understand is joining us from Las Vegas. And so with your permission, Madam Chair, what I would like to do is to go over the bill a little bit in detail and then turn it over to Mr. Norman. And then I think the two of us would be happy to take any questions that you or the committee members may have. Senate Bill 284 aims to increase accountability and to ensure that the children in the foster care system here in Nevada retain their benefits that they are entitled to and that they are set up for financial success. Currently, practice in Nevada allows for all benefits for survivors or other awards payable to a child receiving child welfare services to be deposited in the state treasury for credit to the Trust Fund for Child Welfare. This money is intended to be used to pay for any services provided for the child. This includes covering the basic needs of children in foster care. The problem is that all the money that a child may be eligible to receive through veterans benefits, Social Security survivor benefits, and other funds intended for them are often absorbed into the foster care system rather than being utilized by the child to support their future. Children who often enter foster care due to hardships, loss of family, or other challenges are left with nothing when they are aging out of our foster care system. Additionally, this process happens without their knowledge and without boundaries or safeguards to ensure their financial stability when they age out of the foster care system, resulting in about a 40% homelessness rate within the first 18 months after leaving foster care. Not only are they unaware of where the money intended for them goes, but children and their representatives are often left in the dark about services that they qualify for but do not yet receive. I'm going to walk just briefly through some of the sections of the bill, beginning with Section 1. Section 1 requires an agency that provides child welfare services to determine if each child in the custody of the agency is receiving or is eligible to receive federal benefits through the Social Security Administration or the United States Department of Veteran Affairs within 60 days, and apply promptly for federal benefits on behalf of the child if they determine a child is eligible but is not currently receiving the benefits. This section also requires an agency that provides child welfare services who is receiving federal benefits on behalf of the child to determine in consultation with the child, any parent with rights, and the attorney for the child whether there is a person who is suitable to serve as the payee. If there is no person found to be suitable to be the payee, the agency must apply to be the representative payee for the child and deposit the federal benefits into an account established in accordance with subsection 4. If the application submitted by the agency is denied, the agency is then required to consult with the attorney for the child and appeal the denial if it is in the best interests of the child. Section 4 of subsection 4 of Section 1 requires the agency that serves as a representative payee for a child to establish an account that is appropriate to use and conserve the federal benefits and any other benefits or awards received on behalf of the child. The account may be established and may be without limitation a special needs trust, a pooled special needs trust, an Achieving a Better Life Experience or an ABLE account, or any other trust account that will not interfere with the eligibility of the child for any benefits provided by the federal government, this state, or any agency or political subdivision of this state. They must meet regularly with the child and their attorney to discuss the federal benefits and determine the needs of the child, which include needs related to the future plans of a child who is 14 years of age or older once he or she reaches the age of majority. To provide a financial counseling if the child is 14 years of age or older on preserving his or her eligibility for benefits, the use of the benefits for the needs of the child, and planning for future needs. To utilize the federal benefits in the special interests of the child as determined in cooperation with the child and attorney for the child for costs not covered by the agency as part of the child's care or by health insurance of the child. And this also prohibits the use of the federal benefits for the reimbursement of the agency for the cost of the child care and allow to assess periodically whether there is a person who is suitable to assume the role of the representative payee and who would better serve the best interests of the child. If it is determined that such a person exists, the agency is required to consult with the child, any parent with parental rights, and the attorney about the person identified. Additionally, if a person assumes the role of a representative payee, certain training should be provided to them by the agency. In addition to the account requirements, Section 1 requires the representative payee of a child to at least once every 6 months perform an accounting of the use, application, or conservation of all benefits received on behalf of the child and provide the documentation to the child, to any parent of the child whose parental rights have not been terminated, to any legal guardian of the child, the attorney for the child, and to the court. If an agency serves as a representative payee for a child, the agency is required to not earlier than 18 months before the 18th birthday of the child and not later than 12 months before that birthday, inform the child concerning any actions necessary for the child to continue to be eligible to receive benefits after their 18th birthday and receive federal benefits directly, or designate a new representative payee. It must inform the child concerning any effect of other benefits received by or on behalf of the child on the amount of the federal benefits received, and to assist the child with any actions necessary to carry out the provisions of Section 1. Lastly, Section 1 requires an agency that provides child welfare services to provide appropriate training to employees of the agency involved in the duties pursuant to that section. Section 4 requires the Division of Child and Family Services of the Department of Health and Human Services to, on or before July 1st of 2025, close each account in the trust fund. And if the division is the representative payee for which the account was maintained, deposit the money into an account pursuant to subsection 1, or if the division is not the representative payee of the child, remit the balance of the account. Section 4 also requires an agency in a county whose population is 100,000 or more to take similar action in regard to the Trust Fund for Child Welfare in the county treasury. Finally, after discussing Senate Bill 284 with Clark and Washoe County, we did agree to delay the implementation date by 6 months to January 1st of 2026 in order to give these agencies more time to prepare for these changes and to reduce the overall fiscal impact. So you will see that as a change. And with your permission, Madam Chair, what I would like to do is pass it over to Mr. Norman for some brief remarks, and then again, we'd love to take any questions that you or the committee members may have.
Thank you, Majority Leader. Go ahead, Mr. Norman.
Thank you, Majority Leader, and thank you, Chair and members of the committee, for hearing this important bill. I'm with Jonathan Norman, NORMAN, with the Nevada Coalition of Legal Service Providers. Relevant to this bill, I represent Legal Aid Center of Southern Nevada, which represents almost every child in foster care in Clark County, and Northern Nevada Legal Aid, which represents the same in Washoe County. And these kids, when we talk about foster kids, and adverse childhood experiences, just removal from home means, these kids are at a deficit, right? Any foster child removed, they're removed for some allegation of abuse, right? So there is at least one adverse childhood experience. They are then removed from their parents, so whatever the abuse was, and then the separation from their family, even if it was bad, is something traumatic as well. And then for the children who would be impacted by this bill, we're talking about children who have lost a parent, so they are receiving a federal death benefit, or they have a disability, and so they're on Social Security disability. So we're talking at kids who are really behind relative to their peers who don't enter foster care and are going to face, lifetime challenges that this money is meant to help ameliorate just a little bit. I did want to mention that there are 22 states that have introduced legislation this session. Already 3 have passed: New Mexico, Utah, and Virginia. There are 6 other states that have this already in place, including Kansas, which did so by executive order. And if you look at the states that have already passed this, it's Arizona, Kansas, Massachusetts, New Mexico, Oregon. I'm sorry, I said states, but Washington, D.C. was in there. And then Utah and Virginia. This is a bipartisan issue nationally, whether it's the governor of Kansas ending this by executive order, or the America First Policy Institute did a February 2025 issue brief. And just a few excerpts from that are: states should take action, as has been done in Arizona and Massachusetts, to keep foster children informed about their federal benefits, stop agencies from stealing them, and mandate periodic accounting. Although this process is legal, it is disturbing and harmful. Allowing federal and state benefits to remain with and be used by the child can more directly impact the children for whom these benefits were intended, satisfying the unique unmet needs of those who have a disability, prematurely lost a parent, or will be exiting care and transitioning into adulthood. And when I say it's bipartisan nationally, it's not just this, the American First Policy Institute, which we would assume is a little right-leaning, or the Children's Advocacy Institute at University of San Diego, which is left-leaning. Also, the Dan Lips, a senior fellow at the Goldwater Institute, and a senior education policy analyst at the Heritage Foundation, said child welfare agencies and others who defend this practice argue that using a child's Social Security benefits to support their care is consistent with the purpose of survivor benefits. Foster children already face too many disadvantages. Lawmakers shouldn't allow child welfare agencies to take their Social Security benefits. And then whether it's there or the Federalist Society, this is an issue that cuts across party lines nationally. And it would go a long way to helping foster children in Nevada who have disabilities or have lost a parent to overcome some of those deficits that they face. And that's why I think this is an exciting piece of legislation that will put us in line with the times, as this is an issue that's gaining momentum around the country. And I think it would allow us, we're not quite in the forefront, but we would be very close. As like I mentioned, there are 22 states that have this legislation before them in 2025, and 7 states and Washington, D.C. that have adopted it. And with that, I believe we can take any questions at this time.
Thank you. Thank you, Majority Leader. Members, questions? I do have a couple. Thank you. So this is a really very interesting topic and one. So first I want to thank you for thinking about the children that we're serving in foster care and how are they being financially cared for after they leave foster care and that transition. What does that look like? My first question is really about that pooled special needs trust. It's my understanding that here in Nevada, when there is the death of a beneficiary that has received state services like state Medicaid services, that we're required to pay the state back for services that have been received. And I'm curious to know, in consideration of this language, was that anything that came to light or is being considered as we now create these tools for foster youth?
Thank you, Chair Brown-May. Jonathan Norman for the record. So special needs trusts are governed by federal law, and I believe that they are required to reimburse Medicaid for any expenses upon the death of the beneficiary, and then any remainder is distributed to their heirs or by their last will and testament. So, and the benefits of a special needs trust, my understanding federally, is it allows kind of economies of scale. So the money isn't like pooled where, we're not sure if we're spending this child's money or that child's money. It's all connected to that unique child, but it allows for the pool to be managed at a level that individuals may not have that asset limit to take advantage of those economies of scale. But to your question, yes, absolutely. I think the federal law still requires reimbursement to Medicaid.
Thank you for that clarification. I appreciate that. Unfortunately, it would be really great if we could change the federal law and help that pooled trust, help all kids in need of help. Can you answer currently who is compensated as the representative payee currently, and how is that service funded?
This is Jonathan Norman for the record. I'm not sure if I understand the question, Chair Brown-May.
Thank you, Mr. Norman. So currently, if we have a child in the foster care system, if they have a representative payee and that money is going somewhere and then there is an accounting, I do know that that exists for other populations in our state. Do you know who is providing that service to any of those youth, and how is that service being paid for? Does it come out of the foster care youth's Social Security benefits? How are we paying for that service?
Thank you, Chair Brown-May. I'm with it now. Jonathan Norman for the record. So a few things there. So the child welfare agencies do apply to become the representative payees for children in foster care. And what this bill primarily changes is it's instead of that money being used to fund the cost of that child being in foster care. We're preserving it for that child to use when they leave foster care, however that may be, if it's adoption, guardianship, etc. I will say that in September 16th of 2024, there was a memorandum from LCB to Senator Wynn that details, it had a list of questions that were asked of our three child welfare agencies, Clark, Washoe, and DCFS. And there is a lot of good information there about how much money we're talking about and what that money is used for. And then in certain instances, I will say there is an accounting, right? So if a child has a death benefit, that can often exceed the cost of care. So I think the average death benefit last time I checked was like $1,200, and the cost of care is lower than that. So there is a accounting of that for the individual child. And so we've had children age out of care who received a death benefit, and they were did have some money available for them.
Thank you. And then one last question. When a child ages out of foster care and they leave the system, do they get a check? Are they just cut money, or do they stay connected with a case manager or a financial specialist that can help them execute whatever is left in that account?
Jonathan Norman, for the record. So if a child ages out of care, and that means they didn't find permanency, whether that was reunification with their parent, guardianship, or an adoption, they historically have gone into, we called it AB 350 or step up. That is being replaced in July of this year with extended foster care. So those children they will be adults at that time, but they will stay in care until they turn 21 and continue to have supports from in a different fashion than you would for a child. So they will continue to have supports until they turn 21, and they will continue to have a CAP attorney from our office. They have a worker who's more focused on helping them transition to adulthood. I will say for the special needs trust, that money will stay in that account. And I should back up a second and say if the child is receiving disability, the reason we need those tools like an ABLE account or special needs trust is so that they don't exceed the asset limit, which is $2,000, so they can continue to receive, whether it's Medicaid or the Social Security benefit. If they receive a death benefit, there is no asset cap on that, so they can. The percentage is much lower for how many receive the death benefit, but those would be the kids who would have access to money in a much more ready form when they become an adult. The special needs trust, for example, has prescribed things that it can be spent on, and so does the ABLE account.
Thank you for that clarification. I appreciate the detail and the amount of work that you've done. I just would like to go on the record as saying mine are 27, 24, and 22, and they still need financial assistance and guidance. So the longer we can assist our foster care youth, I think the better, even as they grow into adulthood. Yes.
And Nicole Canizaro, Senate District 6, I could not agree with you more. I think that's why, we see so much work being done in this building around financial literacy for all kids. And one of the things that I did want to note in this bill is that it does require for those conversations to happen once those children are 14 years of age or older, to start talking about that financial piece and having some planning into the future. So.
Thank you. Thank you so much. No other questions from the committee. We'll go ahead and ask you to step back, and we will open up in support. If anyone is here who would like to offer testimony in support of Senate Bill 284, please come forward here in Carson City and in Las Vegas. You will have 2 minutes. State and spell your name for the record. You may begin whenever you're ready.
Thank you, Chair and members of the committee. For the record, Alejandro Rodriguez, Nevada System for Higher Education. NG is in strong support of SB 284. Through our system-wide Fostering Success initiative, we work directly with students who have experienced foster care and help these students navigate financial aid and wraparound support so they can stay enrolled, succeed, and reduce the need to take on student debt. Unfortunately, we continue to see that many students leaving foster care may not know they're eligible for federal benefits like Social Security or VA assistance, or they don't have an advocate to help them access and manage those funds. SB 284 addresses that gap. It will ensure child welfare agencies act in the best interest of the youth by safeguarding their federal benefits, not using those funds to cover basic care, and making sure those resources are actually available to support the student's future. We believe this bill will make a meaningful difference in the lives of current and future NSHE students with foster care backgrounds, and we urge your support. Thank you.
Hello, Chair Brown May and members of the committee. I apologize, I'm a little out of breath. I was in another committee, but Carissa Pierce with Children's Advocacy Alliance, we are in strong support of this bill. It was very thoughtfully put together with children first in mind, and especially our foster youth. Foster youth already go through some pretty traumatic life events that most adults would struggle to cope with. So financial hardship has become an unfortunate expectation that a foster youth is aware of from a very young age, typically from the moment that they enter the system. And it doesn't and shouldn't have to be that way. SB 284 does not present anything new to be created, and instead it protects an existing benefit for foster youth who are eligible and receiving Social Security benefits, including even alerting them that they are eligible where they're not currently being told. The qualifications for eligibility for Social Security benefits means that a foster youth has a disability or has experienced the death of a parent, and both of these circumstances can further set back a foster youth from successfully transitioning into adulthood, as if there are any easy transitions into adulthood. Protecting these benefits that our foster youth are entitled to is essential to support our foster youth and help seed the future of Nevada. So thank you for your consideration of this bill, and please consider passing SB 284.
Thank you. Seeing no one else here in Carson City in support of this measure and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer testimony in support of Senate Bill 284?
If you would like to testify in support of Senate Bill 284, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 284, please press star 9 now. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you would like to offer testimony in opposition on this measure, please come forward here in Carson City or Las Vegas. Seeing absolutely no movement, AVH, is there anyone on the telephone line who would like to offer testimony in opposition on Senate Bill 284?
If you would like to testify in opposition to Senate Bill 284, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 284, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on this measure, please come forward. No movement here in Carson City, none in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Senate Bill 284?
If you would like to testify in neutral for Senate Bill 284, please press star 9 now to take your place in the queue. Again, if you would like to testify neutral for Senate Bill 284, please press star 9 now. Chair, there are no callers wishing to testify neutral at this time.
Thank you, AVH. At this time, we will welcome our bill sponsor back if she would like to make closing comments. Majority Leader? No. Mr. Norman, I see none. Okay, thank you so much for your presentation. We will close the bill hearing for Senate Bill 284. That leads us to the next item on our agenda. We will open the bill hearing for Senate Bill 330, and we will invite up our distinguished Senator Neal. Thank you, Senator. You're welcome to begin whenever you're ready.
Thank you, Madam Chair. Good afternoon, Assembly Committee of Health and Human Services. I'm Senator Neal, here to present SB 330. So what is the purpose of SB 330? So I have a portion in my district, it's called NARA, it's the rural part of my district, which has been on a journey pretty much since 2011 to try to revise a local nursing home ordinance that included the term community residence and included outpatient actually in the definition of what is a nursing home. And so this bill basically makes conforming changes to what is considered a skilled nursing facility and includes the word inpatient. The bill in really simply goes into NRS 244, which is the county ordinance, and then it goes into NRS 268, which is the cities, and then makes the definition, if a skilled nursing facility exists, to align that definition with NRS 449.0039. The effective date of the bill is July 1st. So any existing facility that is currently in place is not affected, but if a new one comes into existence, it then must conform to the actual NRS, and it cannot be different, and the ordinance must be in alignment. And so with that, I will open myself up for questions, because that's essentially what the bill does. So it applies to the counties and the cities and makes them align their definition after a certain date.
Thank you, Senator. That, I think, was our quickest bill presentation to date. Congratulations. Members, any questions on this measure? None. I also don't have any questions on this measure. I think it was really very straightforward. Thank you for your work on this. Okay. We will officially open up testimony in support of Senate Bill 330. If you would like to offer testimony in support on this measure, please come forward here in Carson City or in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line that would like to offer testimony in support of Senate Bill 330?
If you would like to testify in support of Senate Bill 330, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 330, please press star 9 now. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we'll move into into opposition testimony. See, I just skipped right over oppo. Sorry. Thank you. Anyone who would like to offer testimony in opposition of Senate Bill 330 here in Carson City or in Las Vegas? Seeing none. AVH, is there anyone on the telephone line who would like to offer testimony in opposition on this measure?
If you would like to testify in opposition to Senate Bill 330, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on this measure, please come forward. No movement here in Carson City, none in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on this measure?
If you would like to testify in neutral for Senate Bill 330, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify neutral at this time.
Thank you, AVH. Senator, would you like to make closing comments? No, we're getting a no, so thank you. We will officially close the bill hearing for Senate Bill 330. Thank you so much for being here today. That leads us to the third item on our agenda. We will open the bill hearing for Senate Bill 348, which makes revisions relating to laboratory testing, and we will welcome our distinguished Senator Pazina to the testimony table. Please take your time. You may begin whenever you're ready.
Good afternoon, and thank you so much, Chair Brown May, Vice Chair Wynn, and members of the committee, the Assembly Committee on Health and Human Services. My name is Julie Pazina, and I proudly represent Senate District 12 in Clark County, and I'm here today presenting Senate Bill 348, which, as you shared earlier, Chair, makes revisions relating to laboratory testing. Senate Bill 348 in its original form was a much larger bill, so this committee got a lot luckier than Senate Health and Human Services, who spent a lot of time reading. And it covered a lot of things. However, most of the language was deleted by amendment, as I think we all know where we are on a budget front. So appropriations were taken out. I'm here today with a few people. I have Annette Logan Parker, who's the founder and chief advocacy and innovation officer of Cure for the Kids Foundation, and she's in Las Vegas and will be testifying shortly. And I also have Dean Houtman, who many of you are familiar with, from the University of Nevada, Reno Medical School. As a note, we also received a friendly amendment and we'll be happy to review, and we also have Stacy Weeks here to discuss as well. So please let us know if you have any questions, but it should be in Nellis, and I apologize for the lateness of it. It was something that came along as a friendly amendment this weekend that we think will really help this bill move forward in a positive direction. Senate Bill 348 requires the state public health laboratory to charge a fee of $150 for the examinations and tests required for the discovery in infants of preventable or inheritable disorders, including tests for the presence of sickle cell disease, its variants, and sickle cell trait. Additionally, this bill makes conforming changes to clarify that the state public health laboratory is not authorized to establish a fee for the testing, which is now the fixed fee established by Section 3. And I'm going to first hand it over to Ms. Annette Logan Parker in Las Vegas, and then we'll come back to Dean Houtman, and we'll be happy to discuss the amendment and answer any questions. And thank you again for having me.
Hello, thank you, Senator Pizzina. My name is Annette Logan Parker, for the record, ANNETTELOGAN-PARKER. I'm the founder of Cure for the Kids Foundation, the state's largest provider for childhood cancer and rare disease care, and I'm also the current chair of the Nevada Rare Disease Advisory Council. And I would like to say special thanks to Senator Pizzina for taking this on and working through all of those amendments. This particular bill is very important. Newborn screening is one of the most successful public health initiatives that we've seen in our country. And our program in Nevada runs the risk of not only meeting national standards, but it also, under the current situation, is running the risk of not being able to keep up with the recommended uniform screening panel that is known nationally as science and technology improves. It's very important that we include the new conditions on the screening panel. I think it's also very important to say that the fee for Nevada will still remain one of the lowest in the country. Early detection, you would imagine, saves a lot of money. So this particular bill, even with the haircuts, if you will, that it received from the very beginning, is critically important to ensuring the health and welfare of the newborns in the state of Nevada. And I will end my testimony there, and I'm available for questions. Thank you.
Thank you, Chair Brown-May and members of the committee. For the record, Paul Hauptman, H-A-U, P as in Paul, T as in Tom, Mann, M-A-N, Dean at the University of Nevada, Reno School of Medicine. It's also an honor for me to present alongside Senator Pizzina to discuss SB 348, designed to increase fees for newborn screening, which is widely recognized as one of the great advances in clinical medicine. Appropriate screening guidelines are provided by the U.S. Department of Health and Human Services on a recommended uniform screening panel, or the RUSP. There are two main reasons for selecting this panel. Either the condition has an effective treatment, or early diagnosis can prevent prolonged and difficult attempts to diagnose why a baby is not thriving outside of the newborn period. In 2014, the Nevada State Public Health Lab screened newborns for 29 heritable conditions. Since 2023, the lab added 3 additional conditions using ARPA funds that run out in 2026. The lab is planning to add 4 additional conditions, bringing the total to the accepted national standard number of 36. The fee set in 2014 for the 29 conditions was $81, where it remains today, despite inflationary consideration, labor costs, and instrumentation upgrades. This places us in the bottom 5 in the United States. With addition of new conditions, the bill is asking for a total increase of $69, half of which accounts for inflation, and the other half for the new conditions. Stephanie Van Hooser, Administrative Director of the Nevada State Public Health Lab, will break this down for us further in her comments. This is the classic pay now or pay me later situation, with one difference. For the families impacted, delays in diagnosis can be devastating. For example, studies of delayed diagnosis of Pompe disease and SCID, or severe combined immunodeficiency, adds additional costs of $168,000 and $517,000 per case, respectively. I have the list of other conditions for which screening occurs. Among them is spinal muscular atrophy, or SMA, which was added several years ago. It is a devastating condition impacting motor neurons in the spinal cord, leading in some instances to profound weakness of muscles in the shoulders, hips, thighs, and back, and can become apparent early in infancy. Since 2019, there is a novel, one-time gene therapy via intravenous infusion that is available for very young children, and in 2022, a second treatment was approved for use in the first 2 months of life. These treatments allow most children to reach developmental milestones as they grow older. Why am I mentioning spinal muscular atrophy? Because I'm aware that the Public Health Lab has recently diagnosed several newborns with this condition, meaning that treatment has been or can be initiated. Clearly, newborn screening directly impacts the lives of young children and their families. The only question that remains is who pays, and as outlined by Senator Pezzina, and with the remarkable intervention of Stacey Weeks, we have a solution within the Medicaid program to concerns that may arise about this. In conclusion, we will all benefit with newborn screening. Our state needs to be able to offer the standard panel of 36 conditions. It is central to UNR Med's vision of a healthy Nevada, and for all of us here today, and it meets our obligations to the families of the state, our parents and their children. Thank you, and along with Senator Pezzina, I will do my best to answer questions.
Thank you so much. And I believe Stacey Weeks would be happy to come up and discuss the amendment. This sprang out of conversations that she had with UNR, looking at ways that we could get federal funding to cover some of this $150 fee, which is very, very exciting. Hence the amendment. And popping up, I'm going to hand it over to her.
Madam Chair, Stacey Weeks for the record. We did talk to the university and folks on Friday, and we're happy to say that we can help with an amendment to address some of the funding issues. The amendment, I'm not sure if it's posted. It is posted? Okay. It really would just say that if there's sufficient money available, that the state would move forward next summer with a rate increase to $150 for these services. As you heard, it has been over a decade since the rate has been increased for these services, so we do think it's well overdue. We did do a fiscal analysis, and it is under $200,000 a year, but we would have to wait and see until the end of next fiscal year, or this fiscal year. So June 30th, we'd make a decision whether or not to move this forward if we find that there's sufficient funding. Thank you.
Thank you so much. And as everyone has shared, it's a bit of a pay now or pay later philosophy, but it's also looking at the babies that are born, the newborns in our state, and how we can help them lead productive lives. And we look forward to seeing them behind the dais where you're sitting right now, and behind this table where I'm sitting right now as the future leaders of Nevada. So we look forward to helping them in any way we can with this. And I think part of the concern is looking at what ARPA funding is covering right now, and knowing that we would lose access to those 4 tests plus the additional ones we need to meet the federal standards. So we're looking to see what we can do after 11 years of not changing that figure. And while you might not be able to see this chart clearly now, if you look at the red, this is where we are now, at the very bottom, where our funding is. So I look forward to working with all of you to help the newborns in our state and the families thrive. So thank you so much, and we're ready to answer questions.
Thank you. Thank you. Administrator Weeks, please don't leave the table. Thank you. Thank you so much. If you don't mind, we're going to start, though, with some of our committee members, but I do have a couple of questions. Our first question is from Assemblymember Nadeem.
Thank you so much, Madam Chair. Thank you for the presentation. My question is regarding the 29 tests that are being charged $81, and now there are going to be 6 more tests that are included in that, and the charge is going to be $150. So already the patient has to cover for all these tests, or there's some insurance plans that are already covering those tests? How is it going right now?
Julie Pezzina for the record, and I feel certain everyone else could answer this better than I can, but I will say that's part of the global labor and recovery fee, and the patient, the family's not paying for that. That fee is being paid by hospitals right now, which is why we're looking to see if we can get some federal money to help cover that so it doesn't hit the hospitals.
Okay.
But it's not the family covering it.
Can I have a follow-up question, please? So, and there's no insurance that is covering that these tests as of now?
Chair, Committee Member Stacy Weeks, for the record, Medicaid does cover these services at a very low rate. I would assume that private insurance does cover these services, but I defer to Paul here with me at the table. But Medicaid covers nearly half the births in the state, so I think the key here is ensuring the R rate is sufficient at the Medicaid program to help sustain these services.
Thank you so much.
Thank you. Members, any other questions? No, they must have ate pasta for lunch today. They did eat pasta for lunch today. I do have a question. So thank you for that clarification. My line of questioning is very similar, right? Is relative to insurance and how is insurance covering the cost for this test, right? So right now, as you just said, the cost is absorbed in the labor and delivery rate that we're paid, and it's paid from the hospital right now to the lab while the hospital is recovering insurance money. Is that correct?
Julie Pizzina, for the record, that is my understanding, although Ms. Logan Parker may have more knowledge of this situation than me, and I would be happy to defer to her in Las Vegas.
Thank you, Annette Logan Parker, for the record. That is correct. It is currently billed as part of the global labor and delivery fee, and the hospitals do pay the lab directly, and the hospitals are paid through their contracted agreements for that service.
Thank you for that. Thank you. Thank you for that clarification, Ms. Logan Parker. I appreciate that. And so then you stated there are a number of births, administrator weeks that happen that are covered under Medicaid. The amendment that I have in front of me, and I'm going to read it, I just want to make sure we're clear, said shall provide reimbursement at an enhanced rate of at least $150 for all such examinations and tests. I'm curious to know, is it at least or up to or approximately, just so that we have it accurate on the record?
Chair, Committee Member Stacy Weeks, for the record, we at this point could say up to, if you'd like, if that's clear, but we are aiming for at least 150 if there's sufficient funding.
Thank you. I appreciate that clarification. No, I'm good with at least if indeed that is the direction that we're heading. And then one last question. Does this apply to the State Public Health Lab in Southern Nevada that's planned for the UNLV Medical Campus? It would just be for state medical labs. Is that correct?
Paul Hauptman, for the record, the Nevada State Public Health Lab is where newborn screening takes place. To my knowledge, it does not occur in the South.
Thank you for that clarification. Okay, that's all the questions that I have. Members, any other questions? Okay, seeing none, thank you so much for your presentation. We'll ask you to step back. At this time, we'll open up testimony in support of Senate Bill 348. If you would like to offer support for this measure here in Carson City or in Las Vegas, please come forward and fill the chairs. Okay, we have a couple of folks. That's good. We'll start up here in Carson City, and then we'll go down to Las Vegas. State and spell your name for the record, and you'll have 2 minutes. Go ahead.
Stephanie Van Hooser, Stephanie Vanhoosser. Good afternoon, Chair and members of the committee. My name is Stephanie Van Hooser. I'm the Administrative Director of the Nevada State Public Health Lab. In July of 2014, the Nevada State Public Health Laboratory began conducting newborn screening in Nevada. Previously, it was outsourced to Oregon. At that time, Nevada had adopted Oregon's screening panel, which tested for 29 heritable diseases at a fee of $81. This fee has remained unchanged in Nevada for 11 years, while Oregon's fee has grown to $175. The NSPHL, which is the Nevada State Public Health Lab, is the sole provider of newborn screening for Nevada births. According to the CDC, 1 in 300 newborns in the U.S. is diagnosed with a condition detectable through newborn screening, which, as you've heard, many are treatable if identified early. Since 2014, the Nevada State Public Health Lab has received federal HRSA and then recently ARPA funding to expand Nevada's screening panel to align with the federal recommendations of 36 conditions. 3 conditions have already been added, and efforts are underway to add the additional 4 before the ARPA funding expires in October of 2026, ensuring compliance with the recommended panel. The requested fee increase from $81 to $150 is essential to sustain both current and expanded testing. The $69 increase is attributed to inflation over 11 years at $41 and $28 for the added conditions. The fee covers labor, equipment, sample kits, reagents, case follow-up, and clinical consultants. I respectfully request your support for Senate Bill 348. Thank you for your time.
Thank you. Seeing no one else up here in Carson City wishing to offer testimony and support, we'll go down to Las Vegas. You may begin when you're ready.
Good afternoon, committee and chair, and I want to thank you to be able to speak for you with you today in support of SB 348. My name is Summer Webb, and I'm a mother of a child with infantile onset Pompe disease, and I cannot overstate the importance of early detection and life-altering consequences when a condition like this goes undiagnosed at birth. Because my son was born in a state that does not screen for Pompe disease, we missed a critical window to begin treatment early. He went undiagnosed until he was 3 years old when he was placed on life support. What followed was 5 months of life support, ICUs, air ambulances, leaving my other children in complete physical regression and irreversible damage as he fought for his life waiting to be diagnosed. He now receives weekly enzyme replacement therapy, years of rehabilitation, all of which could have been prevented with a single blood spot test at birth. Let's talk about the real cost. It was over $2 million the first year alone, and ongoing, it's over $400,000 annually for his care. Just one case like my son's, one child missed can cost more than the entire statewide increase. One preventable tragedy outweighs the entire cost of updating our entire system in the state. Babies that go undiagnosed with IOPD, they typically don't last a year. They don't live a year without treatment. And so my son was special. He was able to do that. Nevada is one of the few tests that do not states that do not test for Pompe disease. And this is unfortunate. I feel like we're just doing a disservice to the new generation by not protecting these children. And I urge you, and I appreciate you looking at and reviewing this bill today. Thank you.
Thank you. Seeing no one else in Las Vegas wishing to offer testimony and support, we'll go to the telephone lines. ABH, is there anyone online who would like to offer testimony in support of this measure?
If you would like to testify in support of Senate Bill 348, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 348, please press star 9 now. Caller with the last 3 digits, 251, please press star 6 to unmute your phone. Chair, that caller has dropped from the queue. Now we have no callers in support.
Thank you, AVH. At this time, we'll move into opposition testimony. If you would like to offer testimony in opposition on Senate Bill 348, please come forward. Thank you. You may begin when you're ready.
Good afternoon. My name is Patrick Kelly with the Nevada Hospital Association. I want to make it clear that we do support the new born screening test, but as Dean Hopman pointed out, it's just really a matter of who pays for it. We're opposed to the requirement that hospitals pay a proposed 85% increase in state lab fees. We believe that the state should fund the state lab, or if that's not feasible, insurers should cover the cost. As the last speaker just testified, insurance companies can save a fortune by using these early screenings. We think that because they're going to financially benefit from it in the long run, they should be paying for it in the short run. There were questions regarding the payment to hospitals. We basically receive a bundled or global payment for newborn services, both at the Medicaid level and at the private insurer level. So it's not like it moves up. Typically when you're negotiating with a private insurer, they come in and say, okay, we'll pay you 2% more next year. They don't sit there and go through each of the costs. So that's one of the reasons we don't think that we can pass that on easily to them without some type of a mandate. When we look at, I'm really intrigued by the idea that was presented by Medicaid. I think that's very creative and very appreciative of that. But, we have to be realistic that there are a lot of headwinds looking at us. There are proposed cuts on the federal level that may not make that money available. And then would we still have to pay the fee? We're looking at a situation with the proposed tariffs at the federal level. 70% of our medical devices and supplies come from places that are manufactured exclusively overseas. So we are definitely going to see a big increase if those tariffs remain. So the proposed 85% fee increase only adds to the burden, and we just urge you to find a fair, more sustainable way to fund the state lab. Thank you.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, here for the record. Also, respectfully here in opposition. For us, it really is just about bearing the brunt of that expense. The amendment certainly makes it better. And for us, maybe if we can trigger the increase in the fee to the availability of the general fund dollars, maybe that would get us there, because for us, the majority of the births are those Medicaid births. But really appreciate all the good work of the state lab and the work these folks are doing. Tough bill for us to be opposed to, but for us, it is just that math problem. Thank you.
Thank you. Seeing no one else here in opposition and no one in Las Vegas, ABH, let's go to the telephone line. Is there anyone on the telephone line who would like to offer testimony in opposition at this time?
Chair, the public line is open and working. There are no callers at this time.
Thank you, ABH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on Senate Bill 348, please come forward here in Carson City or in Las Vegas. No movement. ABH, is there anyone on the telephone line who would like to offer testimony in neutral on this measure?
The public line is open and working. There are no callers at this time.
Thank you, ABH. At this time, we'll call our bill sponsor back if she would like to make closing comments.
Thank you so much again, Julie Pizzina, for the record. I just wanted to thank you so much for hearing this really important bill, which will make a difference in the lives of our fellow Nevadans. And your committee team was kind enough to make copies of this sheet. So I look forward to having a peek at it and seeing where we rate now and where we hope to rank a lot higher, protecting our newborns. And I thank you again so much for hearing it. And I look forward in the future to answering any other questions you may have.
Thank you. At this time, we'll close the bill hearing on Senate Bill 348. Thank you, Senator, for being here with us. That leads us to the last item on our agenda, which is public comment. If you would like to make public comment here in Carson City or in Las Vegas, please come forward at this time. If you would like to make public comment online, you're welcome to dial 888-475-4499 and enter today's meeting ID, which is 898-537-34811, and then press the pound sign. Seeing no one here in Carson City and no one in Las Vegas, ABH, is there anyone on the telephone line who would like to offer public comment at this time?
Chair, the public line is open and working, and there are no callers at this time.
Thank you, ABH. Okay, members, that concludes our business for today. Our next meeting is on Wednesday, May 7. Please note that we have a robust agenda. We have bills on hearing and bills on work session, and so I would encourage you to make sure that you are prepared for that. While you did enjoy last Friday off, I would not anticipate that will be a future opportunity for you, so please do not schedule super early flights home. With that, we are adjourned.